squamous part, mastoid part, heterotympanic part, it is petrous, and it is tympanic plate, and also styloid process. The first, squamous part. Squamous part has external surface and internal surface. The external surface of the squamous part, in the external surface, you can see this structure. The first, in the external surface, the first, you should see this suture, yes? This suture is located between the squamous part and mastoid part, yes? The squamomastoid suture. Anterior to this suture, you can see a crest here. You can see a crest which is named supramastoid crest. Supramastoid crest. Supramastoid crest, at the inferior and anterior, it travels posteriorly to inferior and anterior to arrive this area, to arrive a triangular shape depression. This triangular shape depression is named supramatal triangle. Here, supramatal triangle. Supramatal triangle is located supero-posterior to this area. This is external acoustic matus. Yes, external acoustic matus. The external acoustic matus is made by the squamous part and the tympanic part. Here is tympanic part. Tympanic part made here anterior, inferior, and inferior half of the posterior surface, posterior wall of the external acoustic matus. See here, it is tympanic plate made anterior wall, inferior wall, and half of the posterior wall of the external acoustic matus. What is this process? Zygomatic process. Yes, zygomatic process which attached to the temporal process of zygomatic bone and made zygomatic arc. Yes. Zygomatic process has in the external, I am saying the external structure of a squamous part. Okay. Zygomatic process has two roots, anterior roots and posterior roots. Anterior roots made a tubercle which is named articular tubercle. Articular tubercle made the anterior part of this fossa. This fossa is named mandibular fossa. Why we named it articular tubercle?
It articulated mandibular.
Yes, because it is the articulated surface which attached to the condyle of the mandible. Okay. And posterior to the mandibular fossa also you can see a tubercle. This is named postglenoid tubercle. Yes, postglenoid tubercle. It is the external surface of the squamous part. The external surface of the squamous part attached to this area. Anteriorly attached to greater wing of the sphenoid and superposteriorly attached to parietal. In the anterior surface, you can see this structure. See here. It is external surface, and if you see the internal surface, you can see this structure. This structure in the internal surface. In the internal surface, you can see some fossa. This fossa is the site for temporal lobe of the brain. Okay, and also you can see some grooves, which these grooves are for traveling the meningeal vessels. Okay, they are the structures in the internal surface of the squamous part. Another part here, this is a natural scar. In the mastoid part, his occipital part, it is
external
yes, you know
acoustic meatus.
better than me. external osteogmatus. Posterior to external osteogmatus, you can touch mastoid process. Yes, mastoid process. The mastoid process has external surface and internal surface. The external surface is rod because it is the site for attachment of a strong muscle. This muscle, yes, SCM, external clado, mastoid muscle. And excuse me, all this area is mastoid part. All this area is mastoid part, but inferior elongation of the mastoid part, which you can see posterior to the auricle, is mastoid process. Okay. It is the external surface, but see the internal surface. In the internal surface, you can see a groove which is S-shaped. Is named sigmoidal groove. Anything which is S-shaped is sigmoidal, like sigmoidal colon. Yes, it is S-shaped and is named sigmoidal groove for the sigmoidal sinus of the brain. Okay. Posterior to the sigmoidal groove, you can see a small foramen which is named mastoidal foramen. Mastoidal foramen is the site for attaching a hemisphere vein. So we can see in the internal view at the posterior part of sigmoidal groove, and the external view is here. In the external view is located in the mastoid part. Mastoid process, which I said that it is elongation, inferior elongation of mastoid part, has external surface and has lateral surface and medial surface. See here, if I ask you that the medial surface of the mastoid process is seen in the internal view of the skull or external view of the skull, what do you answer?
Medial, internal.
No. External view. It is mastoid process, okay, has lateral surface and medial surface. Here, medial surface. Medial surface is also seen in the external view of the skull. Okay? See here. See this moulage. It is mastoid process. It is lateral surface and it is medial surface. Okay? So the medial surface is seen in the external view of the skull, not internal view. I said that we have two structures in the medial surface. Which structure? A groove and a notch. This groove is named occipital groove for traveling the occipital artery. This notch is mastoidal notch for attachment of posterior belly of the gastric muscle. Yes?
Yes.
Okay. It was occipital mastoid part. Squamous part, mastoid part. Another part is the tympanic part. Here. Tympanic part made the anterior, inferior, and half of the posterior wall of the external osteogmatus. It has anterior surface and posterior surface. Anterior surface participates to forming the mandibular fossa. Yes?
Yes, sir.
It is articular or non-articular?
Articular.
No.
Non-articular.
It is non-articular area of the mandibular fossa. Okay? Non-articular area. Inferior border of the tympanic plate, it is tympanic plate, it is inferior border. Made vaginal process. Here is named vaginal process. Which vaginal process covers the roots of the styloid process? It is a styloid process. The root of the styloid process covers by the vaginal process of tympanic plate. Okay? And here is the styloid process, which is the site of attachment of several muscles and ligaments. Here is petrous part. Petrous part has three surfaces and three borders. In the external view, you can see just inferior surface of petrous part. Okay? Inferior surface of petrous part, you can see in this area, this is the structure. The first, a canal, you can see a canal in this area, is named carotid canal for traveling the internal carotid artery. Posterior to the carotid canal, you can see a fossa. This fossa is named jugular fossa. I said that jugular fossa attached to jugular notch to form jugular foramen. Yes? And also a root area, which is the site for attachment of the muscle. The petrous part is like a pyramid, which has apex and has base. The apex attached to a sphenoid bone. When the apex attached to a sphenoid bone, made foramen lacerum. Yes, foramen lacerum. In the internal view, in the natural skull, here is
External
apostygmatus. Anterior of external apostygmatus is tympanic plate. Inferior border of tympanic plate, styloid process, which is broken in this skull. Styloid process. Here is mastoid process. Between styloid process and mastoid process, you can see
stylomastoid foramen.
Stylomastoid foramen. Okay. Here, tympanic plate in the medial part drive to petrous part. Stylomastoid foramen. It is mastoid process, it is styloid process. Just between two processes is here. Okay?
Yes, sir.
It is petrous part. In the petrous part, I said that we have a canal. See here? See this canal? Okay? It is carotid canal. Posterior to carotid canal, we have a fossa, jugular fossa. Here, this foramen is foramen lacerum. Okay. In the internal view of the skull, you can see posterior surface, anterior surface, superior border, posterior border, and anterior border of the petrous part. Which structure can you see in the posterior surface? This foramen. External, internal, acoustic matus. Posterior surface of petrous part, internal acoustic matus. Okay? Posterior to external acoustic matus, here we can see a fossa, subarcuate fossa. Also in this area we have a small foramen which is named vestibular aqueduct. In the anterior surface, see here, anterior surface of the petrous part. It is better in this skull. What is this foramen? It is the apex. Of the
lacerum.
Foramen lacerum. Yes, foramen lacerum. Just lateral to foramen lacerum, you can see a small fossa which is named. It is the site for location of trigeminal ganglion. Is named trigeminal impression. Yes, trigeminal impression. Lateral to trigeminal impression, in this area you can see an eminence, arcuate eminence. Also you can see two small grooves in this area, which are the grooves for greater and lesser petrosal nerves. They are structured in the anterior surface of petrous part. See this border. Superior border has a groove. This groove is groove for superior petrosal sinus. This groove for superior petrosal sinus. Posteriorly, petrous part attached to mastoid part, and also made a small groove in this area, which is named groove for inferior petrosal sinus. Anteriorly, petrous attached to, excuse me, it is posterior, it is anterior.
Yes, yes.
Anteriorly, petrous part attached to,
Frontal.
no?
Greater
Greater
Sphenoid.
wing of sphenoid. Yes, greater wing of sphenoid. It was the temporal bone. Petrous part of temporal bone. Another bone is sphenoid bone. See, the sphenoid has the body, lesser wing, and greater wing of sphenoid. The body has this feature. Superiorly, ethmoidal spine attached to ethmoid, which you cannot see in this area. But this smooth area is jugum sphenoid. This smooth area is jugum sphenoid. After jugum sphenoid, you can see tuberculum sella. Tuberculum sella. Tuberculum sella laterally has two tubercles. Middle clinoid process. Here you can see
Hypophyseal
sella turcica. The deeper part of sella turcica is named hypophyseal fossa. After hypophyseal fossa, you can see
Sella dorsa.
dorsum sella. Dorsum sella also has two tubercles.
Posterior glenoid.
Clinoid tubercle. Here is the greater wing, excuse me, the lesser wing. Lesser wing anteriorly attached to frontal
Frontal.
bone. Posterior border is free, and here you can see the anterior clinoid process. So anterior clinoid process is a part of
Sphenoid. Lesser wing
of
of.
the sphenoid. The lesser wing of the sphenoid in the medial part covers this canal.
Optic.
Canal.
Optic canal.
Yes, optic canal. Lateral to the body, you can see two grooves. This groove is, what is the name of this groove which is located lateral to the body? No, carotid groove. Carotid groove is the site for traveling internal carotid area, and also sinus cavernous. Sinus cavernosum is located in this groove. Here, in the greater wing, you should recognize three foramina. From anterior to lateral and posterior. From anterior to lateral and posterior. Anterior groove is foramen rotundum. Foramen rotundum travels posterior to anterior in this area. Here is foramen ovale, and here foramen spinosum. Yes. The sphenoid also has trigoid process. Here is sphenoid in the natural skull superiorly. This fossa is
Hypophyseal.
hypophyseal fossa. In the inferior view, you can see the trigoid process. The trigoid process of sphenoid. Trigoid process has two plates, medial and lateral. Also in this part,
Medial.
and lateral. The medial plate inferiorly has trigoid hamulus, yes. Between medial and lateral, in the inferior part, you can see a fissure, trigoid fissure. Also, between medial and lateral, at the superior and posterior view, you can see this fossa.
Pterygoid fossa.
Fossa. Excuse me. Fossa. medial plate attached to palatine bone. Palatine bone, I said that it is L shape. Okay, horizontal plate and perpendicular plate. It is horizontal plate of palatine bone, and it is perpendicular plate. Perpendicular plate attached to medial plate of tragoid process. Okay. See here. It is the hard palate. Hard palate is formed by horizontal process and palatine process of the maxillary bone. Palatine process of the maxillary bone. Horizontal process of the palatine bone laterally has screws or this canal, greater palatine canal. Posterior to greater palatine canal, we can see a small groove, lesser palatine canal. Okay. The maxilla has the body and fore process. This process is frontal process. Frontal process. This bone is nasal bone. So frontal process is located between nasal bone and lacrimal bone. Here is lacrimal bone. In the body, inferior to the orbit, you can see infraorbital foramen in this area. Infraorbital foramen. Inferiorly, this process is named alveolar process. This process is named palatine process. This is named zygomatic process and frontal process. Four process. The palatine process, when two palatine process attached together, posterior to the incisive teeth, you can see a foramen. Naso incisive foramen. Incisive foramen is Y-shaped, yes? Begins from this area and travel superiorly to arrive to the inferior part of the nasal cavity, just lateral to anterior nasal spine. It is anterior nasal spine. Okay. Another structure in this area, zygomatic bone. Zygomatic bone in this area, you can see this foramen.
Lesser wing of sphenoid also forms superior orbital fissure.
Yes, I will show. No. What this foramen is? Zygomatico facial foramen in this area. At the posterior part of the body of zygomatic bone, also we have a small foramen which is named zygomatico temporal foramen. Okay? The